Hello, my name is Alexandria Mason. I'm a producer with Milwaukee PBS, and today I'll be speaking with Karen Dotson about the disproportionate number of African Americans that are being impacted by COVID-19 in Milwaukee. Karen Dotson is the program director for the All of Us Research Project at the Medical College of Wisconsin. So Karen, as you may know, April is Minority Health Awareness Month. So to start us off, could you just tell us a little bit about what the All of Us Research Project is?
Yeah, thanks, Alexandria. The All of Us Research Project is basically looking at precision medicine. And so what we are doing is that we are enrolling, and we've been charged with the National Institute of Health to enroll on a national level. We are in partnership with different entities, a total of 10 different states, to enroll 1 million people into the program. And so we are charged in the Wisconsin area, actually, to enroll 100,000. So what this is that really looking at how we can get information from participants, and we call them participants, but these are people that are involved in the community, in the state, all various different parts of the state. We are asking them to enroll into our program. And basically what this will do is that it'll allow for researchers to get a really large sample of different information from individuals as far as how it relates to research. And so what this really will allow for us to, as African Americans, to be a part of this program. Basically, in the previous times of research, African Americans are somewhat limited, and we have rights, we have understanding and rights of why we feel that way because of some of the challenges we have had with research in the past. But that has also affected us as far as being able then to look at what really causes a person to be healthy and what really causes a person to be ill and what type of medications are being ordered by their physician. And so if they do not have the research from people of color, when we're doing this and when they're studying what works best for people, then our medications aren't as effective as it should be.
So can you tell us a little bit of your thoughts on why African Americans are being disproportionately impacted by this virus?
It's really kind of interesting you say that, and I really have to go with some socioeconomic issues because I think that poverty really has a lot to do with it. And then also education, as far as how are we educating the community about this virus. It's so interesting that you said that as far as like, why is it impacting us? And I can give a prime example. Like when a couple of weeks ago, I was looking for some sanitizers and disinfectants, and you know how you go to some of the larger stores in the surrounding areas, and I couldn't find any. And then I was in the inner city, and I was like, well, let me just go to one of the major stores there. And they had a lot of disinfectant wipes and everything right there on the shelf. And it made me realize that because we were in an area that is somewhat poverty stricken, it really makes you realize that some people can't afford the disinfectants. Some people can't afford the sprays, the sanitizers for wipes and things like that for their hands. And so they're looking at, I got to buy food for my family. I have to, make sure that my children are eating. And so that's some of the challenges that I really feel in our community. And also when we start looking at how our living arrangements, a lot of us are living in apartments, some are living in houses that are closer together. So that allows for the virus to spread quite easily. And so those are some of the challenges that people have. And then also you have to realize that everybody can't stay at home. People have to figure out, how am I going to continue to work to do what I need to feed my family, to pay my bills?
One of the key effects of it is that the impacts that the virus has on your respiratory system. What do we know about African Americans and respiratory diseases? Are they impacted by more respiratory diseases than other minority groups?
I would say yes. When you start looking at a lot of African Americans are affected with asthma. A lot of African Americans are affected, excuse me, with sarcoidosis on a higher percentage than others. So when you start looking at some of the respiratory challenges that African Americans have, then you will see, yes, that's one of the reasons why with this COVID-19 that they're being more effective because of the challenges that they have. And then also, when you start looking at some of the immune systems and some of the challenges that you have in that area, that also can affect individuals as well.
When you say immune systems, what type of challenges do you mean? Are there are African Americans, do our immune systems tend to be weaker? And is that why we're more strongly impacted?
When I start looking at that, I also look at nutrition, because a lot of times we can't afford like vitamin supplements compared to others with vitamin D and vitamin C and all those things that help the immune system. So there are some challenges there. But also when you have some of the respiratory problems and people are taking other medications and steroids, that can also affect your immune system.
So how does our nation's delivery of healthcare services, how does the healthcare system and what's accessible to people, how does that play a role in this virus?
Well, what's accessible? I think that, when you start looking at um, different communities are limited as far as healthcare providers. And then also you have to look at that some individuals don't have insurance, so they feel like if they go to the hospital, if they go to the doctor, they're going to be charged for the service. And so that's why it's really key. As the Medical College of Wisconsin, we do partner with some of the federally qualified health centers, and those are some of the community health centers in the community. So we believe, and we also understand and know that individuals sometimes can't afford treatment. And so what a lot of the times those individuals do is that they wait until they are to the point that they're very sick before they decide to go in. And so that then causes for different types of results, different types of treatments from those individuals.
How would you say we can do a better job of just spreading the word and educating the African American community more about this virus, ways to treat it, ways to prevent it? I know, that there a big criticism has been, how are we, really getting the message out? Do you have any ideas on that?
Well, I think that we have to definitely look at some of our leaders and our church leaders and politicians and things in our community. I know that some of the aldermen and some of the legislators, they are looking at how they can how they can educate the community as well. Being a part of some of the radio stations and just having some of the different advertisement and marketing materials out there for people. But also, I think that the key is that people have to understand that it can affect them, whether they're young, whether they're old. And a lot of times, some of the things that people have seen previously on television, they felt it won't affect them, but it will.
How do you think the All of Us research project can play a role in this?
It's really interesting because our program, we have staff that are calling individuals to inform them about our program, but we also then share information with them on COVID-19 and if they have, concerns, what they should do, and different resources that they can get information, additional information. As it relates to the virus. And so we've been able to educate people on that level. And so the other thing is that to let people know, as far as with our program, it allows for when you start looking at genetics and things of that nature and some of the challenges that African Americans have, this program will allow for individuals to get to understand and know more about some of the challenges that they might have within their I would say their families and hereditary types of issues as well.